Welcome to 843 TV. I'm your host, Kathryn Mademann, and today we're going to stop at the clinic here at the Bluffton Jasper VIMS because we're going to have a discussion. We're going to meet with 3 important health clinics that are part of the Beaufort County. And we'll have a chance to meet with Toney, who's the Executive Director of the Bluffton Jasper Volunteers in Medicine. And we'll meet Cassi Kirkpatrick, who's the Executive Director of Good Neighbors Free Clinic in Beaufort, and Dr. John Newman, who's the Executive Director of the Hilton Head VIMS program. So we have a lot to talk about, and I think you're really going to enjoy this show. So don't go away. We'll be right back with 843 TV.
.843 TV, where the Lowcountry comes to speak.
.843 TV,
where communities come to speak. Welcome to 843 TV, and I'm really delighted with this show today because we have brought 3 important medical clinics that offer services to our community. And with me, I have Toney, who is the Executive Director. We have Cassi Kirkpatrick, and I have Dr. John Newman, who is with the Hilton Head VIMS program as well. And in this discussion today, we want to talk about the community that it serves. And I think I'm going to start with Dr. John. Let's see how we talk about your community of Hilton Head.
So who do we serve? We serve anybody who lives or works on Hilton Head and Defusky, who really has a good job, doesn't have health care, and there is a federal poverty line less than 250. So those are the folks that we're looking to help take care of, or to basically continue to keep this community healthy.
Right, I understand that. I mean, Pam, what's your perspective?
Well, there's approximately 19% of the people in our communities, Beaufort and Jasper and Hilton Head and Bluffton, that are without health insurance, which is hard to believe. And these people are our neighbors often. They're people that work for us and work with us, and they need to have quality health care. And so this is something that we're able to provide for them.
Well, that's an interesting statistic, too. I didn't realize that.
Yeah, it's a high statistic. It really is. And these are really people that very often work. 65% of our patients do work, but they just can't afford health insurance. And so there's a definite need in the area.
And now, Cassi, tell me a little bit about your program.
So Good Neighbor Medical Clinic, we're in Beaufort, and we do the same. We treat folks without insurance. We treat adults that are uninsured, and they or either live or work in Beaufort, and they are just like Pam and Dr. Newman has stated. They work. Over 50% of our population work, but they just can't afford health care. So we like to pride ourselves on being their medical home. When they get into our clinic and trust us, they tend to come back, and that's what's really important, that preventative care.
Really? So now, tell me about, how many people do you serve in your clinics right now?
We have a little over 700 patients enrolled right now. So it's hard to believe in that small area there's that many, but that's just a tip of the iceberg. There's many more that still don't know about us. And so this is a great opportunity to spread the word about the care that we offer.
And how long have you had that clinic?
The clinic's been, it was incorporated in 2007, but it didn't open its doors until 2009.
All right. And so you have a full service clinic as well?
Yeah, we're primary care. Our main program is primary care, but we do have a lot of specialty care as well.
All right. Tell me a little bit more about that, because that's Beaufort County. So we are Beaufort County, but we have, we have our Bluffton, we have our Hilton Head, but I'm still love to a little bit more about your program.
So Good Neighbor Medical Clinic is located right across the street from Beaufort Memorial, which is wonderful. We just moved about 1.5 years ago. Our big partner is Beaufort Memorial Hospital, right, which we couldn't survive without them. And it's actually their building that we reside in. So again, we're primarily primary care, but we do have a lot of specialty like podiatry, ENT, GI, cardiology, GYN. We have a physical therapist on board, and we also have diabetic educators and a health coach.
And do you have children's population as well? Do you have pediatrics or just adults?
No, thank you for asking that question. It's always nice to provide education to the community because a lot of people wonder, why don't we treat kids? And the reason is we provide access to care for those who don't have access. And the Medicaid guidelines are children have access to care through Medicaid.
Oh,
but adults do not.
Yeah, I'm curious, what is the age group for that? Do you know the details on that at all?
It's up to 18, am I correct on that? Yeah.
Oh, okay.
So anyone up to 18
has medical care, and then thereafter, right, that's why they come to the clinics.
That's
I
right.
did not know that. Huh. And
It's a-
so this clinic, we don't
see children. We don't. So, but Hilton Head Volunteers in Medicine does.
We
You
do.
see
We've
children.
got several pediatricians who've retired on the island that are engaged with the care of our children, as well as our dental clinic sees children. And even during the pandemic, I would say the dental clinic was amazing that they just kept on seeing the patients. So, and I would say that, you know, the pediatric population is cared for by these other things. So I think the community is doing a great job, and children can get access to care, but we do also take care of the children in the community.
Oh, that's terrific. And what do you think about I mean, how many people are involved with the clinic, who are coming to the clinic, patients, I should say?
Yeah, last year we did about 25,000 patient visits. We did about 40,000 prescriptions. We helped take care of about 250 surgeries, you know, outside in the community as you go forth. And we've got primary care, we've got dental care. We do have some mental health, and I think we'll probably get to talk about mental health, because I think that that's one of the areas to where it's like, this is where 1 + 1 + 1 hopefully can equal 10 as we come together and tackle problems. But mental health is the one thing that we're doing, but we realize there's a world of care that we need to care for.
Yeah, and we will talk about that further, as you're saying. But, you know, Pam, I want to get back to you, because what's interesting, though, we started with the Bluffton clinic, and now you have another clinic. Tell us about that.
Well, when we became a Volunteers in Medicine clinic in 2011, one of the stipulations was that eventually we would get into Jasper County. And so for the first few years, we were only in Bluffton seeing Jasper County patients, but they had to come to see us, which was challenging for transportation. So in 2011, through grants and donors and donations, we were able to open our Jasper clinic. And now we're open 4 days a week, which is really exciting. We're doing so well, as a matter of fact, that we need to expand. And at the moment, we're doing a campaign to raise money for that exact thing.
Really? Well, I mean, again, you're reaching out to the community. I want to ask, when did that clinic open again? I remember.
In 2011.
Okay.
No, I'm sorry, 2016. Thank you. I'm glad you
2016,
asked that. That's
because
right.
I didn't know, and that we have the services. Do you find that the medical staff, they go back and forth between the two
They
clinics?
do. Our medical director actually has a clinic on Mondays, and then she comes here on Wednesdays and then our cardiologist goes out there, and really all of our doctors go out there sometime during the month.
Really?
Yeah.
Well, I know this is really fascinating. So we're going to take a break right now. We'll come back and talk about more of the services here.